It's 11:31. We'll get started. Thanks so much for being here. Very inspiring to see all these medical colleagues here speaking to this issue, coming down to the Capitol to express their fervent concern about what is happening in the state of Minnesota and how we care for our neighbors and how we care for our patients. My name is Matt Klein. I'm a state senator from Senate District 53. I represent the southern metro area, and I have for the last 9 years. I am a physician, an internal medicine physician currently at Mayo Clinic, but for the bulk of my medical career at Hennepin County Medical Center. And let me say that in my capacity as a physician for the last 35 years, I have cared for numerous patients where there were legal and formal interactions with law enforcement, particularly at Hennepin County Medical Center, where our local law enforcement and our sheriff's deputies have a firm understanding when they have a patient in legal custody, when they have a patient from the jail or from the prison, they are able to bring that patient in full discretion and interact safely and with privacy with the medical staff and do it well. I've never heard a concern over 35 years of practice that a patient's rights were violated, that medical care was impeded, or that privacy was violated. And yet we hear these stories now for the last couple of months here in the state of Minnesota that in our hospitals and in our clinics, patients are afraid to come in and seek care. When they do come in, ICE is pursuing them with or without legal means or justification for that. And our medical staff feel intimidated and afraid to do the good work that they should do and impeded from doing that good work. This is intolerable to us as practitioners, and I believe it's intolerable to the good people of Minnesota who know how medical care works in this state. This morning I learned for the first time through an NPR story that Renee Good still had a pulse 8 minutes after she was shot by an ICE agent. And yet the offer to administer aid from a physician on the scene following his Hippocratic oath was denied. I can't say how much that stirs the blood of everyone behind me here as we try to fulfill our obligation, our oath, and our duty to care for the people of Minnesota, and I believe it stirs the blood of every patriotic Minnesota who knows how we treat each other in this state. So that is what we are here to speak to today as healthcare professionals. We have representatives from pediatrics and emergency medicine, from the American Medical Association, from the chapter of gynecologists and family physicians, and I will turn it off now to Dr. Emily Wagner from the American College of Emergency Physicians.
My name is Dr. Emily Wagner. I am here on behalf of the Minnesota chapter of the American College of Emergency Physicians. Minnesota ACEP is dedicated to the health, safety, and dignity of all individuals who seek care in our state's emergency departments and pre-hospital settings. We want to partner with everyone as we are committed to ensuring the safety of all our patients and staff, especially during times of discord and violence. In light of recent events, our priorities remain clear. Number 1, uninterrupted access to care. All patients, regardless of background or circumstance, must be able to access emergency medical care without fear or delay. Emergency departments serve as a vital safety net for the community, and any factors that deter individuals from seeking necessary care endanger public health. Number 2, protection of emergency responders and medical personnel. EMS providers, emergency physicians, nurses, and support staff must be able to perform their duties without interference or obstruction, as timely care should never be hindered. Number 3, coordination at the scene of emergencies. During emergencies involving law enforcement, clear communication and established protocols between medical responders and other agencies are essential. Ensuring that medical personnel can reach and treat critically injured patients promptly is a fundamental component of life-saving care. Number 4, patient-centered standards in hospitals and clinics. Emergency departments and hospital facilities must remain safe spaces where patients and families can seek care. Policies and procedures should protect patient privacy, clinical decision-making, and the prompt delivery of medical services. Patients brought in by any authority should receive medical evaluation and treatment according to medical need, not status. And finally, number 5, upholding the mission of emergency medicine. Our commitment is to human life and well-being. Emergency physicians and care teams stand ready to care for all members of our community, regardless of the context in which they arrive. We advocate for practices that prioritize health outcomes, minimize harm, and support the trust that patients place in emergency medical systems. Minnesota ACEP encourages all involved parties, including medical professionals, first responders, and public safety officials, to work collaboratively to ensure that emergency care is accessible, timely, and delivered with compassion to every person in need. Thank you. Next, I'd like to introduce Dr. Jana Gewurz-O'Brien with the Minnesota chapter of the American Academy of Pediatrics.
Thank you. Good morning, everyone. I'm Dr. Jana Gewurz-O'Brien. I'm the president-elect of the Minnesota chapter of the American Academy of Pediatrics. We are the leading voice of children's health and well-being in our state. I'm here representing more than 1,000 pediatricians across our state who are committed to improving the health and well-being of children all across Minnesota. We are here for the kids. As a pediatrician working in the heart of downtown Minneapolis, and as a mom whose 10-year-old co-wrote this statement with me, I can attest firsthand that ICE enforcement in our communities is directly harming my patients and our kids. And to other parents watching these atrocities unfold in front of them in their communities, we should all be very, very concerned. And here's 3 reasons why. First, exposure to violence and the threat of family separation causes trauma for kids. When ICE enforcement occurs in or near places where children should be safe, like homes, like schools, like hospitals, and we know they're in hospitals, right? Children experience fear that disrupts their sense of stability. We've seen kids face down in handcuffs in front of their public schools. Teens have been ripped from their homes without coats in sub-zero weather and without their parents present, let's just be real. Parents have been detained while waiting for the bus with their kids. Family separation is not a temporary disruption. It is a traumatic event with lifelong consequences. And for Renee Good's children, I know other parents are thinking about them. They deserve better too. We need ICE out of our communities. Second reason why. Children and families are avoiding potentially life-saving medical care because they are terrified to leave their homes. When ICE agents are in and around our hospitals, which again, we know that they are, including my own, parents are rightfully scared to come in. I've seen babies miss their jaundice follow-ups or straight up say, hey, I refuse to come back in. I really don't feel safe here. We've seen moms that have called and said, my baby's having trouble breathing. I don't know if I should come in. Unacceptable. And we've seen a burst appendix that could have been detected days earlier had somebody not been afraid to come in. Across our state, kids are missing their routine checkups. They're delaying care. They're not seeking help. And they're weighing this fear of putting their family at risk against the health of their child. This is an impossible decision that no parent should ever be in. Healthcare settings need to be safe, healing spaces, and we need ICE out of healthcare. Third and finally, when ICE is perpetrating violence in communities, kids get caught in the crossfire. Consider Destiny Jackson and her 6 kids. They were coming home from a basketball game. They were in their car, they were not a part of a protest, and they found themselves in a car full of tear gas with airbags deployed. Destiny could have been any one of us as she administered CPR to her infant child. And when their parent asked for help, there was a delay in getting emergency medical care. Again, we see a theme. This is unacceptable. Chemical weapons have no place in our neighborhoods or in our schools. They can have life-threatening and long-term effects on children. It's only a matter of time before a Minnesota child dies as a result of this recklessness. We need ICE out of our state. To close, I have a message for Minnesota parents. Your pediatricians and all of us are doing every single thing that we can to mobilize. We're working to get kids life-saving care in their homes and in their communities. Your pediatricians are still here, and we're all in this together. I'm going to try this in Spanish. Estamos aquí para ustedes. Llámenos y trabajaremos juntos para conseguir la atención médica que necesitan, ya sea en su comunidad o en su casa. If I could say it in Somali, I would do that too. Nosotros, los pediatras, los médicos, estamos en la lucha. We are in the fight. We demand that ICE stop tactics of terror and leave our state. Our patients, our children deserve to be safe, to be healthy, and to grow up free from fear. And to our leaders, protecting kids is not a political act. It is a moral responsibility we all share. Thank you. I want to introduce Dr. Mattson from the Minnesota Medical Association.
Thank you, and good morning. My name is Dr. Lisa Mattson, and I'm the current president of the Minnesota Medical Association, an organization that represents over 10,000 physicians in Minnesota. As president, I personally have been made aware of the presence of ICE agents in our hospitals. I had a report of a detainee in the ED with injuries inconsistent with accidents. I also had a report of a vulnerable adult who didn't have a caregiver with him to help him make important medical decisions. There are reports of ICE agents refusing to leave the room for private exams or while patients are getting bed baths. There are also reports of staff experiencing rude and harassing behavior from ICE agents. Their mere presence in the emergency departments make a difficult job even more stressful for all the staff, thus interfering with patient care. We also know that people are not going to their regularly scheduled doctor's appointments, as was mentioned. This is adults as well. They're not leaving their homes for work or school. They're not picking up their prescriptions or getting their vaccinations. And they're not obtaining healthy food for fear of being detained by ICE. This means that acute and chronic illnesses are not being managed properly, and that it increases the likelihood that these individuals will end up seeking emergency care. Preventive care is always better and cheaper than waiting for an emergency to arise. We're also concerned about the indiscriminate detention of anyone with brown skin, including Native Americans, who are the only people among us who are not immigrants. A report by one of the local news agencies last week reported that only 5% of detainees in Minnesota have a history of violent crime. And in the worst of the worst, 7 of those people's only crime was a DUI. Under EMTALA, the Emergency Medical Treatment and Active Labor Act, which was codified in 1986 under President Reagan, all physicians are required to provide emergency care for any patient, regardless of citizenship, legal status, or ability to pay. We also swore an oath to take care of all of our patients with unbiased, respectful, and dignified care. The MMA wants to ensure that all Minnesotans, regardless of immigration status, have access to safe and timely and high-quality medical care, and that ICE enforcement actions do not interfere with that care and undermine the health of our communities. Thank you. I'm going to pass this over to Dr. Stevens.
Thank you all so much for being here. My name is Dr. Erin Stevens. I'm the legislative chair for the Minnesota section of the American College of Obstetricians and Gynecologists, otherwise known as ACOG. As stated in our committee statement, Healthcare for Immigrants, released by ACOG's Committee on Advanced Equity in Obstetric and Gynecologic Healthcare, the American College of Obstetricians and Gynecologists supports the health and well-being of all who seek obstetric and gynecologic care and advocates to secure quality healthcare for all without regard to immigration status. Policies that infringe on the health and rights of immigrants and limit access to health care, anti-immigrant rhetoric, and punitive immigration enforcement activities all have detrimental effects on health. In my personal experience and that of many of my colleagues providing care in our state, we are deeply troubled by what we have seen. Before this surge of activity even began, I was on shift at my hospital walking outside our emergency room entrance, which is prominent, the first thing you see as you drive up to the hospital. And just outside the ambulance bay in an area meant for patient pickup and drop-off, I witnessed multiple unmarked vehicles with tinted windows park in that area. They were stationed there for quite some time, with agents going in and out of the hospital doors. I was immediately concerned for my patient's safety and privacy, and I cannot imagine how patients felt seeing the same activity, particularly the patient population we serve who are immigrants or could potentially be subject to racial profiling. Immigration official presence has, of course, significantly increased in our state since that time. Last week, ICE agents accompanied a patient into the emergency room of our hospital, worrying other patients and care providers alike by their presence and uncertain levels of access. The presence of these agents at points of clinical care intimidates patients, threatens their privacy, and obstructs access to care. Many of our patients, undocumented immigrants, naturalized citizens, and U.S.-born citizens alike, fear leaving their homes for access to health care. They express to us a feeling of being hunted. Our patients are missing, canceling, or deferring important appointments for prenatal care out of fear of being targeted by immigration officials in their place of care. Anecdotally, many of our labor and delivery triage units are seeing lower volumes as a sign that individuals are not seeking out care with urgent concerns. Requests for resources for home births are up significantly, even among patients who had never previously considered this or for who it is not a safe option, and that is probably the most common thing I am seeing discussed amongst healthcare professionals. Some are birthing in the hospital alone, with no family, friends, or personal support present due to detainment or fear thereof. Patients presenting to outlying hospitals in greater Minnesota with serious conditions are refusing transfer to the metro area for higher level of care. The impact of intimidation and profiling on patient care and outcomes is real and may perpetuate already existing disparities in healthcare. We want to assure our local communities that individual providers, clinic groups, and hospitals are working to increase home health visits, mobile visits, and telehealth care, while also solidifying and strengthening on-site protocols to address our patients' needs in a safe manner. Our community is rising to meet the needs of our neighbors. As OBGYNs caring for those in our community, we affirm our commitment to the compassionate care of all of our patients without regard to their immigration status and oppose activity that restricts or obstructs that care. I will now turn it over to Dr. Dwevetti from the Minnesota Academy of Family Physicians.
Thank you. Good morning. Thank you for the opportunity to speak. I'm Dr. Rolly Dwevetti, a family physician and the immediate past president of the Minnesota Academy of Family Physicians. I'm here today on behalf of the MAFP that represent more than 3,100 family physicians, residents, and medical students across the state of Minnesota. We provide care to all Minnesotans. Today, alongside with my colleagues from other specialties, we reaffirm our shared commitment to safe, equitable access to care for every Minnesotan and raise our concerns about current immigration enforcement impeding that access and spreading fear across Minnesota. No patient should ever hesitate to seek care because they worry about their safety or the consequences of walking into a healthcare facility. I have been a practicing physician for more than 19 years here in Minnesota, and I have never seen this level of chaos and fear in the healthcare for patients and for our healthcare teams. It is tragic and is unthinkable. It is more challenging than the acute part of the pandemic in many ways. I want to share the reality of what physicians, nurses, other specialists, therapists, pharmacists, students, and our state future workforce across Minnesota are seeing right now. These are not just missed opportunities or appointments. These are life and death crises. There is trauma and moral injury. Last week, a patient with kidney cancer vanished from his scheduled visit. When his clinician called, they found he had been detained and moved to Texas without his medications. While legal intervention eventually got his medication to him, we still don't know if he is actually taking his medications. No one deserves to die or suffer because of how they look or how they speak or where they were born. In another case, a patient with insulin-dependent diabetes stopped coming to the clinic. We discovered they were not just not out of medicine, but they were out of food. They were rationing both the insulin and their meals without knowing how to adjust insulin. We are seeing levels of food insecurity that are simply horrific. A pregnant mother missed her checkup and stopped answering her phone. A nurse went to her home and found her 8 centimeters dilated. Laboring alone and terrified to seek help. She delivered just 2 hours after the nurse finally convinced her it was safe to go to the hospital. The cycle of fear is claiming lives. Recently, a patient discharged from the hospital missed their follow-up because they were too afraid to leave the home. What should have been a routine wound care appointment turned into a life-threatening case of sepsis. A simple office visit would have solved them from returning to the ICU, and we know our ICUs are already filled. The trauma we are witnessing is horrific. In our clinic parking lot, a mother and a son were forcibly separated from while trying to fill a prescription for a seizure medication. The trauma triggered a medical crisis. The son was rushed to the hospital in the midst of a seizure, while his mother was sent to a detention center in Texas. In Wilmer, Minnesota, fear is paralyzing the community. Families with legal status are sleeping in trucks to avoid home raids, choosing the cold and illness over the risk of separation. One teenager nearly collapsed from starvation, surviving on a single egg in 3 days after her entire family was detained. Our places of healing are under siege. I was notified that a clinic was surrounded by masked, armed individuals and orange buses with blacked out windows. When a clinic like this is treated like a tactical zone, who would feel safe enough to go to the healthcare facilities? Dental appointments have dropped in half. Several clinics have reported no-show and cancellation as high as 60%. We know from the pandemic the consequences of postponed medical and dental care. In primary care, we see firsthand that when people delay or avoid care, the harm compounds. Chronic conditions worsen, injuries go untreated, preventable complications grow more serious. Our patients and communities are scared. I have dozens of other stories to share, but the bottom line is this making America healthy again? I stand here with others representing healthcare providers across Minnesota, pleading on behalf of our patients and communities and our staff. Healthcare is a fundamental human right. Our communities deserve to be safe and healthy, but right now we are failing to meet the promise. It's time we immediately change our course. Thank you. And with that, I will invite Senator Mann.
Thank you, everyone, for being here today. I'm Senator Elise Mann, Senate District 50, and I am a family medicine and ER physician. You've heard stories today about ICE agents inside of our hospitals, ICE agents walking into patient rooms without warrants, ICE agents setting up shop outside the emergency room doors, ICE agents waiting at clinics to separate families as they walk in to get their medications refilled. At no time, the only other time in history I can remember having a group of physicians standing in front of you was during COVID. Because you have any idea how hard it is to get doctors from across the state and across all specialties to join together. This is a moment of crisis in this state because of ICE and their presence in our healthcare settings. You have a group of people in front of you today who have sworn to take an oath have taken an oath that to do what's best for and to take care of our patients. The presence of ICE officers in our hospitals is preventing doctors from doing that. Again, you've heard the firsthand stories about how ICE is acting illegally and unconstitutionally. They are acting unlawfully and in turn are jeopardizing patient care and the health of our patients. This is not making our city safer. It is about harming entire communities, making certain that certain communities feel afraid to go out to get groceries, to go to school, to go to work, and now are afraid to get medical care. We are here today because we want the rest of the country to know about what is happening inside Minnesota hospitals and inside of our clinics, because it will happen in your state also if it hasn't already. And lastly, we want the world to know that not only will the people of Minnesota stand in solidarity with each other and protect one another, but Minnesota doctors will stand in solidarity and we will protect our patients. With that, we are happy to take any questions.
Do you have any legal recourse to try to, not allow ICE into those so-called public spaces? Or is there any legislation you're planning in February to address it?
Well, and I don't know if you have anything to add, Matt. ICE is allowed into public spaces, right? It is the private spaces that we have a problem with. They should not be allowed inside patient rooms when they are taking their baths or when they are getting examinations. We have reports of ICE agents bringing in their patients with injuries that are completely inconsistent with the stories that they are telling, and they are not allowing the patient to tell their side of the story of what happened. This is what the issue is. The problem is that we can pass 110 laws, but ICE is already acting above the law. They are already acting unlawfully and against the Constitution. We have Fourth Amendment rights that protects these private spaces, and they don't care. So we can come up with 110 different laws. Certainly, we have no guarantee that they will follow any of them.
I think there still may be a role to introduce legislation this coming session, which is never required previously because there was always a Minnesota understanding of how law enforcement acts in healthcare settings. But now that we see it violated repeatedly, we should at least codify what best practices are for that interaction.
Does anyone have an interpretation on HIPAA? I mean, that's a federal law, but it's supposed to protect patient privacy. Is anyone being able to invoke that to get a federal agent out of the room?
We have reports that we have invoked everything that we have at our hands to get ICE agents out of the rooms, including calling the police, calling administration, calling hospital security, and they have refused to leave.
Has this been happening like all over the state, like in rural areas as well? I know there's been reports in the metro, but what does this kind of look like statewide?
Yeah, this is happening across the state. I mean, you can pick a city, it's likely represented here, and they can tell you stories about what's happening in their hospitals.
I think I'm hearing, I heard a few examples of close calls, but are we talking about actual cases of patient harm, malnutrition, and patient suffering? I'm wondering if we're
Thank you so much for the question. I think if the preventive care is not given in a timely manner, it can become into a complication. For example, that baby that delivered 2 hours after the patient was brought to the clinic. What if that baby delivered in the house and there was like no care in the house and baby was asphyxiated and died? So these were the things that we have to be thinking about. I know that there's a patient that I heard that they were just so afraid and their colon perforated. And rather than being into like just the thing that could have been just treated with a course of antibiotic that led to a 1 month of hospitalization, but that could have been life-threatening as well.
Yeah, so it's not close calls, it's actual harm, right? We have perforated colons, we have burst appendixes, we have the patient who became septic and needed ICU care. These are very much real stories and real harm that is coming to our patients.
What would you say, I know obviously the focus should be on the patients, but for all of you, what's morale like? You went through COVID, your lives on the line.
Well, first of all, half of our staff are not coming in at the hospital where I work. Our healthcare workforce is extremely diverse. The people taking care of our patients are Somali, they are Latina, and when we look at the nurses, at the healthcare assistants, and at the physicians, many of us are also from backgrounds that are actively being harmed by the campaign of racial profiling and hate that ICE is perpetrating. So yeah, our staff are really worried, and it's incumbent on all of us to, one, protect our staff and protect our patients too. So I would say morale is down. And I would say, yeah, I think especially with these people who did show up every day of COVID, who showed up after Annunciation, and there was a shooting at where many young people came to my hospital, who've really showed up day after day taking care of their communities, to then see themselves and their family members at risk of being detained and their children separated from their families. Yeah, I would say morale is low. Okay, yeah.
Can I say something?
Doctor, you just said it earlier, I'm a registered nurse, and I'm hearing you directly, that hospital administrators are allowing HIPAA violations, is that correct? Is that what I'm hearing right?
Thank you for the question. No, I don't think that's accurate. Again, the stories that we are hearing is that ICE is showing up and everyone is getting called down to say you have to leave. And it is ICE who's refusing to leave, despite being told by administration, by local police, by security.
Oh, good, thank you.
Yeah.
Thank you for the clarification.
I'm a pediatric emergency medicine physician at Children's, Dr. Jha. So I work overnights at Children's, and I had a patient show up at 4:30 in the morning. I might start crying. She had 4 children with influenza, vomiting, diarrhea at home. She had to triage, self-triage, and think which is the sickest kid. So all night this lady was watching out of her window. She said, when I felt that the road was clear, she brought her 13-year-old in, and she had a 6-year-old, 8-year-old, and a 3-year-old at home with worse symptoms than him, but she said they wouldn't know what to do if ICE vehicle was around. And there is this 13-year-old who has not known anything else except the United States of America, sitting there traumatized, lethargic, dehydrated to no limits. So I think we are endangering these children, not only for their illness from today, but they are being traumatized they're going to be traumatized, an entire generation, for which mental health resources would need to be unlimited for next several years.
Can I ask you, you've been talking about telehealth, but that doesn't get the drugs to people that need it. Are clinics or anyone taking any extra steps to get people to get care to people beyond what they would normally do?
That's a great question. Several clinics and organizations and healthcare systems are working on the telemedicine, but the fear is so intense. People are scared of picking up the phone even. So I think we have to start working from that level. How do we build that, rebuild that trust, and create the system where safety comes first, and people are deprioritizing their health. And at least I can attest, speaking for myself, but I know there are people here that we call patients, they won't pick up a phone, and I sometimes keep calling. And the next day they will pick up a phone. So just depending upon how much time we are spending, and telehealth is there, but it's not being utilized to its full potential.
Can I add one more thing about that? I do want to just share, again, this is a message to families, that your pediatricians and healthcare professionals are working to organize to actually bring us and bring medicines to people's homes. I'm not going to share more details about that because, believe it or not, there has been retaliation and we're worried about naming specific systems here. But yes, please call us. Do not be afraid to make the phone call because we will work with you to get you the care you need wherever you are.
Thank you.
Thank you.
Hi, my name is Krista. I'm a registered nurse. I've been a healthcare administrator for most of my career now. I operate a nonprofit that is designated solely to take care of healthcare professionals' own health and well-being. It's been hard to find moments of hope in our state, and seeing all of you here, I just want to applaud you for standing up and for speaking and using your voices as experts, as people who dedicated their lives to doing nothing but care for others. I also want to give this message to you that I have hundreds, if not thousands, of nurses who are willing and ready to stand alongside of you in that U.S. citizens for 23 years have nominated nurses as the most trusted profession in the U.S. So if we can use our voice in any way to support you as experts who understand mental and physical health and all the needs of our community, we are here. Thank you.
Thank you, everybody.